Hi, my name is Linda. I'm a psychiatrist psychotherapist based in Melbourne. I am in public setting across the Royal Melbourne Hospital and the Royal Children's Hospitals. I also have an academic position at the Department of Psychiatry at University of Melbourne. A particular personal and professional interest brings me to you today to share about mindfulness. The background to it is my rather chronic practice of meditation for many, many years, which morphed into a professional interest and curiosity in the last 15 years or so. That's contributed by the fascinating and emerging evidence showing that benefits can be obtained by mindfulness practice in certain psychiatric conditions, in health and well-being. So I wanted to have a grounding in the philosophy of mindfulness and the science of mindfulness. So I completed a contemplative Buddhism-based psychotherapy course, which is on a background of my psychodynamic psychotherapy training from our college. I also am trained in mindfulness teaching as a teacher through UC Berkeley. Now the question is, what is mindfulness? Mindfulness is paying attention in the present moment, on purpose, and non-judgmentally, as if life depends on it. Now, that is the most famous and most common definition of mindfulness offered by Jon Kabat-Zinn back in 1970s while he was working at Harvard University with patients with chronic pain. And he developed mindfulness-based stress reduction, which is the most researched based mindfulness tool or technique that we have available to us. So, simply speaking, mindfulness is a particular way to pay attention to experiences. And that particular way is a caring and curious attention. What does all that mean? So, in mindfulness teaching and practices, one learns perhaps 4 basic foundations to enter the world of mindfulness. So there is mindfulness of the body or the sensations, mindfulness of the feelings, the thoughts, and the mental state and the experiences within the mind. So basically, the contents of the mind that we have are thoughts, feelings, emotions, judgments, and various kinds of ideas. All of them can be the focal point of mindfulness. And a meditator takes it as a project to appreciate why the mind visits frequently to the past or fantasizes into the future and really struggles to stay in the present moment. And that is a I guess a skill one masters, and it takes time, it takes practice, it takes patience as well. And mindfulness is being talked about in all realms at present, from politics to leadership to teaching in schools, universities, science, healthcare and mental health treatment settings. So even though mindfulness is everywhere at some level, it didn't come in this millennia. It didn't come from science or for our society. Mindfulness came 2,500 years ago from Buddhism, and it came at that time with the intention to understand the processes of the mind, so that human beings had the capacity to learn how to disentangle oneself from the causes and conditions of the suffering, and aim towards a joyous and peaceful and content existence. That is also crucial in the time of pandemic, and I believe there is a possibility that mindfulness may offer some benefit to us in this extraordinarily stressful time in our lives. And I suppose no conversation on mindfulness is complete without a little detour into the scientific findings. And the particular study that fascinated me came from Harvard. Sarah Lazar and her team published that research in 2005, and it showed that daily mindfulness practice within an 8-week period can actually contribute to brain structural change. And the areas of the brain engaged in attention, sensory processing, and interoception were affected. And it showed increase in cortical volume in prefrontal cortex and right anterior cingulate. And that is been a very significant progress in kind of mindfulness research. A long way to go to actually replicate and validate this particular study. And I suppose another study that came out in 2014 from UC San Diego, Fadel Zedan and team, which showed that in patients with anxiety, mindfulness practice actually contributes to activation of the prefrontal cortex and the anterior cingulate cortex, which actually contributes to executive control and paying attention in the moment of acute anxiety arousal when the brain goes into flight, fight and freeze and faint mode. It also shows that posterior cingulate cortex, which is related to mind wandering and rumination, is deactivated. So anxiety-related preoccupations can actually be minimized with mindfulness practice. There are many other studies, and we know for those of you who are abreast about the path of mindfulness in psychiatry, we know that in 1979, mindfulness-based stress reduction came to the world, and in 1987, Marshall Linehan developed dialectical behavioral therapy, or DBT, which is significantly reliant on mindfulness techniques. And then 1989, Stephen Hayes and his work on acceptance and commitment therapy also incorporates mindfulness. 2000, the group from UK, John Tisdale and his team, the mindfulness-based cognitive therapy, came into being. 2009, Paul Gilbert's and his compassion-focused therapy. 2013, Kristen Neff and Chris Germer from US developed mindfulness, mindful self-compassion training. And then most recently, 2013, again, the Stanford team, led by James Doty, developed compassion cultivation training. So there is a significant amount of focus and attention and research going on in utilizing mindfulness for psychological health. With that brief comment on research, I also want to highlight that there's an enormous amount of research, and some of them are more hyped about or more talked about, and don't seem to be based on solid scientific foundation or have the scientific and methodological rigor to actually show that the study itself, the design and the results are analyzed and interpreted in a way that is possible to replicate and generalize. So that's a word of caution. As a scientist myself, it is helpful for us to be aware, because our communities and our patients may look up to us to support them in appreciating mindfulness in a kind of objective way, since we are the experts of the mind. Another kind of caution in mindfulness is around the way it is promoted and the way it is appearing at the moment to us. So it can seem like one size fits all. I don't believe that is the case, and that's okay. And also how it is being delivered and taught. So the ethics of the teachers and the ethical standards the teachers are abiding by are critical, at least for me. I also want to mention about trauma and how trauma triggers could occur with mindfulness practices. So it is crucial for one approaching mindfulness to be aware that there can be certain experiences which are not pleasant through the training. It is also useful to know that mindfulness is not a substitute to medication, and that is not the part of this conversation, but it is also, I guess, relevant in understanding mindfulness. How can mindfulness help us in pandemic? We are going through one of the most extraordinarily challenging and stressful times in our lives as doctors. What I've seen this year in my mindfulness teaching, as I've offered classes to doctors, staff at the hospital and at the research center, I noted that there is a genuine and enormous curiosity and willingness to learn about mindfulness for absolute beginners. And I think it's a great first step, because with time we get to appreciate in mindfulness a very basic phenomena or operating mechanism of the mind. So what happens is when we have a positive or pleasant experience, the mind drifts towards it. Mind wants more and more of it and bathe in that experience and doesn't want that to go away or finish. And when there is a negative or unpleasant experiences, the mind wants to walk away, move away, avoid and shunt away from that experience. So there is this polarity of how we relate to our experiences. With mindfulness practice, a meditator learns to see and witness this habitual tendency of the mind. And then what happens when there is a stimulus and there is an automatic reaction that the mind generates? The meditator learns to actually sit with that acknowledgement, sit with the realization of this is how the mind operates. And then there is a spaciousness. So what we say is that the way the mind and the way the self and I relate to the external environment transforms through mindfulness practice. So what traditionally would have been extraordinarily stressful, maybe there will be a different way to relate to it. Maybe there will be a capacity, a spaciousness, that the mind and the body and the self is not reacting to the experience as it did in previous times. With that, mindfulness also then incorporates a capacity of self-compassion, a generosity and kindness towards oneself. In pandemic, the other aspect that is really amazing is to recognize that there is a huge amount of suffering that's going on in the world, and we are all equal in that. I don't think anyone is safe from COVID in any way. So that's a common humanity that we are recognizing at this time, and one can bring mindfulness to that realization and see that we all have sufferings and challenges and obstacles in our lives, and appreciate the blessings and the joys of this life and the opportunities we have, and learn how that can be utilized for the betterment of our patients, our colleagues, our peers, our communities, our families and friends. And I suppose that's where ultimately mindfulness can be contributing to a lasting change, a lasting impact, should we want that to actually touch our lives.